more than 2 million Ontario students are heading back to school, and tomorrow, Toronto classrooms will be buzzing for the first time in 6 months. With the more contagious Delta variant spreading through our communities, the risk is real. CityNews has learned that the data being used to reassure families that schools are safe is outdated, with one expert suggesting that parents and kids are being misled.
I am confident that the school setting itself is safe.
That from Ontario's medical officer of health this week. He backed up his claim with national data.
This was just recently shared with us last week. 87% of the time when a child got COVID-19, the virus actually spread within the social circumstances, in the home or after school activities. Only 7% of the time was the school the source for the infection.
However, schools have been closed for months across the country. In Ontario, they've been shuttered since April. So CityNews asked, how useful is this data?
I'm going to guess that data was before we were dealing with the Delta variant as the dominant strain, because schools have been closed for 6 months.
You're right. It would have been, it was Canadian, and so any school closures in Ontario, that data would have had a broader base of population information, and it wouldn't have caught Delta.
Quite simply put, you cannot do that. It is not valid, and Dr. Moore should know better than that. And because he should know better than that, I'm going to call that negligent.
I would have had a broader base of population.
We played Dr. Moore's answer to our question for epidemiologist Colin Furness.
I think he might be realizing in real time as he's answering your question that he has painted himself into a corner. That is not competent. That is simply not competent. Delta is different. The transmission characteristics are different. We have a lot of data right now from the UK. We have a lot of data right now from the United States.
A report just released last week by the United States Center for Disease Control found hospitalization rates rose rapidly during late June to mid-August of this year among U.S. children and adolescents. The rate among children aged 0 to 4 years was nearly 10 times the rate 7 weeks earlier. This increase coincides with widespread circulation of the highly transmissible Delta variant.
So the question for Dr. Moore is, what is it about Ontario that makes it different somehow? What is it about Delta that's going to behave differently in Ontario? And I don't think there's a scientific answer to that question.
Education Minister Stephen Lecce had this to say about school safety around COVID on City TV's Breakfast Television this morning.
We do believe our school system is as safe as possible, and we will do anything and everything encouraged and required by public health to keep these schools safe.
That's a false statement. That's just a categorically false statement. If you're not doing asymptomatic screening in schools, if you're not requiring teachers to be vaccinated, if you're not requiring kids over 12 to be vaccinated, you're not even remotely doing the steps, taking the steps that would be needed to make schools as safe as possible. They're not as safe as possible. They're not in any way safe.
There are nearly 350,000 elementary and high school students in Toronto. In-person learning resumes at almost all TDSB schools this Thursday.